The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Asia's Health Livestream with yours truly, Dr. Tom, and we've got a great program for you as we always do on this platform. We're going to talk a little bit more about your back, but some things that you hadn't thought about. I did a program this last Tuesday evening, as we do the second Tuesday every month with a group of about 60 plus doctors, and we started going over some concepts that a lot of us, see automatically with the patient, but we always forget to explain it adequately with our patients. So patient comes in with low back pain and they think it's the low back. Well, as you've learned already, if you've been paying attention to this ongoing series on low back, you know that it can come from so many different areas. We talked about internal and visceral problems that relate to the back. We talked about temporomandibular joint. We talked about a lot of different things. I want to expand that a little bit because we were talking about it as a group of docs who are very intuitive relative to diagnostics and then treating the situation. But we're going to talk about what happens when you take a blow to your head. And you're going to say, take a blow to my head? What are you talking about? Think about all the times that you've had either subtle, very gentle bumps and lumps to your head. You hit it against a door, walking through a threshold. You got into a little tussle when you were young. You were in a car accident. You hit your head on the steering wheel or even heavily on the back of the seat, depends on the direction. You were horsing around for whatever reason and you got smacked in the head. I'm going to show you what happens. Now that's your head. We're talking about low back pain. We're talking about chronic pain that just doesn't want to go away. So how is that related? Well, let me show you a little basis of what we're dealing with. Here's your spine. This is you, right? And this low area here in the spinal system, this is your pelvis. Now we're looking at it from the front to the back. If we turn it to the side, right, this is what it looks like. These are your hip bones. These big holes right here are where your legs insert into the pelvic girdle. If we turn it around, you see this wedge-shaped bone here. That's called the sacrum. We have the iliac crest here. And then this area as a group, these five bony areas are called the low back or the lumbar spine. Now we know what we're talking about here. That causes the pain. But the triggering mechanism may be further up. This is the back of your head. We got a cutaway of this big old noggin called your head. And it sits on top of the spinal column all the way through. These little bumps and lumps, these are the little spinuses that we've talked about so often. And in the front, we see these little off-colored shock absorbers. Those are called the intervertebral disc spaces. And then you see the nerves as they exit. Now, what does all of this have to do with all of this? Well, actually, quite a bit as it goes on. See, you have a wrapper, a very hard matter that covers your brain, and it's attached to your skull. And it exits through this big hole back here. And it comes all the way down the spine, but it attaches first to the second bone in your neck. And then it free floats all the way through until it gets down and attaches here again. So let's keep this in mind, that the mechanism of movement here, because of the attachment of that hard matter, which is called dura, hard, and it comes all the way down and reattaches here. So whatever moves here is going to move here. Conversely, whatever moves here will also affect that other area, but we're talking about it from this way down. So let's get into it just a little bit. Let's talk about what the triggering mechanisms can be for those low back, because this is a situation that most physicians, even natural physicians, forget to focus on. So I want to make sure that you understand that when you treat something, you have to look at the body as an integrative intimacy that works in cooperation, one piece to the other. You know, the old saying, the ankle bone's connected to the knee bone, connected to the hip bone, connected. That's really how it works. And so we want you to get that. And I think you're going to have a really good appreciation for that. Coming up very quickly this coming week, the 16th of July already, Dr. Harlan Browning and I, we're going to do a tag team with you. We're going to talk about low back pain. I'm going to do some demonstrations. We talk about a muscle, you know, in the mouth. Remember, if you've been watching this, called the pterygoid, that restricts motion of the hip. We're going to show you how that actually will free up very quickly. We're going to show you what happens with your thigh muscles. And if your low back is locked and not moving the way it's supposed to, that you can't even go up the stairs, we're going to show you what happens when this frontal bone locks down and it's not moving as it should, and that the back of your legs, the hamstrings, aren't firing the way they're supposed to. All of these things can lead to back pain, but there's an intimacy, if you will, between all of these things. And we're going to explain that on Wednesday night. So join us. All you have to do is call the office at 703-698-7117, or as you can see in front of you right now, go to drtomroselle.com or rosellecare.com. Join us. I promise you, you're going to learn a lot about what's going on. We're going to give you some protective mechanisms, things that you can do preventatively. We're going to talk about a lot of different pieces of that puzzle. So let's get into the program just a little bit. And so you understand what happens when you have a traumatic situation. You know, back pain and headaches, let's put those together for a second. They can work together, and there's a lot of different reasons for it. So even ladies, if you have a PMS problem that you think is a PMS, it may not be hormonal. It's presenting itself as if, and because of your age and so forth, your doctor's going to say, well-meaning, that this is the deal, right? Well, maybe. And it could be some other pieces. There could be, you know, a blood supply problem, and so forth and so on. But let's talk about what really happens with this ongoing process that can cause one or the other. But in this case, we're talking the head and the low back. Sometimes you may experience a headache as a secondary situation to the low back. Is it because that low back pain has been there for so long and it's just, you know, you're stressed out and it hurts you and you're going to put your hand up at the top? Maybe it's possible, but more likely it's because of that mechanism that we just told you about, with that covering, that sheath all the way down the spinal system. Now, here's the deal. When you have back pain, if you look solely in the back, you're not going to get anywhere. But we want to find out what the major triggering mechanisms are. Low back pain can be a result of other types of distortions, traumas, injuries, further up the scale, all the way to the top of the head. Now, if you have what's called tension headaches, the back of your head is irritated, there's going to be a balancing act, if you will, at some point. That balancing act will take it all the way down to the lower portion of your spine, your low back. Why? Because it's a compensatory mechanism. How? Because of that attachment that I showed you a little while ago, where that dura, the hard matter that comes off of the protective mechanism of the skull, attaches to the second bone and then free floats all the way through and then affects the low back. So when you have a distortion in the pelvis and injury here, you can reflect as a headache. If you have distortion here long term, it can affect that balance of that dura, that covering, all the way down to the pelvic structure. So tension headaches that you're taking all these different types of pain medications sometimes are nothing more than a heads up that you've got something else going on, and we have to look at other parts of the body. Now, pain can be mild to moderate. It can be very severe occasionally, where it's disabling, you can't move. You can have other situations. If your low back is bothering you, you're going to have perhaps constipation problems, which we're going to talk about, by the way, in the programs coming up. You can have erectile dysfunction, you can have ovarian problems, you can have reproduction problems, and so forth and so on. But when you have head pain, when you have something that just doesn't want to go away, there's something else with it that could be causing your problem. So could your headache be coming from your low back? Yes. Could your low back pain be coming from your head? Well, the answer to that is also yes. So if that's the case, how do we distinguish that? And on the 16th coming up this week, we're going to go into that. We're going to go into it quite in depth and show you those kind of things. Now, look, here's the deal. When you have anything that affects the nervous system is global. So we talked about movement of the temporomandibular joint. Any kind of blows or traumas is going to offset this. The balancing act is the sacroiliac joints that I just showed you, and we've talked about repetitively. If you don't fix this, you can never fix the low back. If you don't fix the low back, you can never fix this. And now that's considering that the structure is anatomically normal, meaning that there's, you weren't born with a genetic deficit. You didn't have a short leg anatomically on one side. That's a real anatomical shortening. So if we have any of those things, we've got to find out what the cause is. Let's talk about trauma to the head and why things occur. So let's say that you get into a blow, you hit your head, back of the head, right? You get a concussion there for whatever reason. And I mean, it's a concussive force, not necessarily leaving you with a concussion. Now, all of a sudden, you're moving these upper structures. When the upper structures are locked in tight, the muscles in the low back, the muscles that support the low back, are not going to work the way they're supposed to work. So if that's the case, and you keep treating that low back without looking up here, it's never going to go away. It might make it feel a little bit better, but you have to get to somebody who really understands that beauty of intimacy between the upper portion of the structure and the lower part of the structure, because they work together, they work cooperatively and in sync. So think about all the times you had a little bit of a trauma, a blow to your head, right? It could have been very mild. The other night on the talk that I had with these 61 doctors that were there, we showed them and talked about a couple of different expressions of how one piece affects the other. One of the things that I told them about is, we'll go back to the back of the leg, the hamstrings. The hamstrings pull down on the pelvic structure in the back. So if they inhibit, if they weaken, meaning that they're not firing the way they're supposed to, that instead of working at 100% capacity, they're only working at 75% capacity, then your sit bones, they're called the ischium, rise up. And what it does when they rise up is they jam this low back area. It basically does this. Watch what happens, like this. So if it jams like this, now you've got this pain here. But remember I said it may be coming from the upper portion. So how can low back weakness to the hamstrings, allowing the rise of the ischial sit bones, if you will, we'll call them sit bones, because if you're sitting there listening to me right now, that's what you're sitting on, the ischium. How does that work? Well, the frontal bone, your forehead, is supposed to move when you breathe. And it's a compensatory mechanism to move spinal fluid up and down the spine. But what we know neurologically is that if this is locked for some reason, because you took a bump in the head, if it's locked in some way, because when you sneeze, this is a trauma, you hold your breath. Or when you cough, you hold your breath. Or when you bear down to go to the bathroom, you're holding your breath. Those cause the bones of your head, you remember 22 of them, to lock in place, lock tightly, and the spinal fluid is not going to move. Then what happens, if this is the guy that's taking the primary locking, if you will, the hamstrings, those muscles behind the back of your legs, aren't going to work the way they're supposed to. So we lie a patient down, face down, and we test the hamstrings, and neither one of them are responding to more than a few pounds of pressure. And they weaken, they inhibit. That means that pelvis is rising up, and that low back, as we said a minute ago, gets jammed like this. And it's pressing the nerves, it's pressing and compressing the muscle patterns. And you got pain, you got chronic pain. One of the indicators of that is if you go downstairs, it's very difficult for you to go downstairs. Not so bad going up. You want to, I got back pain, but when I go downstairs, it hurts me. And you find yourself going down, sidestepping. That's an indication that those hamstrings aren't working, but it may not be a primary triggering mechanism from your low back. It could simply be that something happened to your head and that frontal bone is locked. So you have to look at both pieces of it. So trauma, old trauma, continues to perpetuate itself. Now, with the doctors that we, we had online the other night, we told them, said, listen, patient's in front of you, and you have to make sure that you ask the questions about tension headaches and frontal headaches, visual disturbances. Then the next piece is simply this: did you have that before the back pain, or did they start up about the same time? That's a clue. And it can be from a car accident. It could be a fall. And the car accident doesn't have to mean that you took a blow to the front of your head by hitting the steering wheel. It could just be the ricochet whipping where the head's bouncing or the brain's bouncing off the skull bones. Those are the things that we see often, and unfortunately, way too often. So when you're looking at a back problem that doesn't want to go away, and you've gone to great doctors, they know what they're doing when it comes to a focused, intentional application of something, but it never seems to completely clear up. It's because something is being missed. And that something that's being missed is often an old injury to the head. And the skull bones aren't moving the way they're supposed to. So we said injury can be what? It can be you're holding your breath when you sneeze. An injury can be that you took a blow years ago because the body remembers that it was never fully rectified. Instead, you took some aspirin and you say, okay, call me in the morning and see what happens, right? It can be something where you're constantly in a state of stress and you're clenching your teeth. I have a patient yesterday that he's on the table, and this poor guy is, he has to work out, but he internalizes stress so fast. I test a muscle on him, and the first thing I see him do is clench his teeth very, very tightly. Well, I know in 2 seconds when that happens, and he's doing it habitually, that his back isn't working either. And so we showed him how that was true, how that was so. The occiput, this big old head of yours, if it's stuck on top of your neck, right, and it's not moving the way it's supposed to move, there's two muscles called the iliopsoas muscles. Everybody's heard the psoas muscle or the iliacus and so forth. It comes from this part of your low back. This is the front. It comes off of these bones here, and then it goes all the way down, and it actually will attach into the leg bone. So if it's working the way it's supposed to, it keeps a balance in the spinal system. But when it doesn't happen, the back locks back like this hard, and those muscles can inhibit both of them bilaterally. And if the iliopsoas muscles aren't working the way they're supposed to, you got back pain. And it didn't come because you got back pain. It came because you hurt your head. So you have to fix the head to fix the back pain. You see how these little pieces have to be looked at in a cohesive pattern? You have to find somebody who understands that. Wednesday night on the 16th, 6 p.m. at the Roselle Center for Healing, we're going to walk you through it. We're going to show you. I have the privilege of co-teaching with an amazing doctor, Dr. Harlan Browning, who many of you know. We've lectured together over the years. We call him the professor because he's brilliant. So join us, and we're going to put this pattern together for you. We're going to show you exactly, what the mechanisms are, how they take place. Wouldn't it be great to really you know, even if you're not one of our patients, but you go to a doctor out in your area, whatever state that you're in, whatever part of the country you're in, and say, hey, do you really understand? Or I wouldn't say it that way, you probably irritate them, but, could there be a possibility that my low back pain that's not clearing up, that you're making better, but it doesn't want to go away, is coming from the upper part of my neck and head, and that the movement of my skull bones, the upper spine is locked, and that occiput, this big old bone there, is not moving the way it's supposed to? It's a good possibility. And if he says no, can't be that, maybe you may want to get a second opinion someplace. The International College of Applied Kinesiology, which is I'm the immediate past chairman of, are a group of very brilliant doctors. And if you want to see somebody that's near you, you go to icakusa.com and go to find a doc and see if there's anybody around you. But this Wednesday, we're really going to get into it. Please understand that back pain doesn't happen just because it wants to pick on you, unless you've got one of these overendowed midlines that you haven't worked out in 10,000 years. You sit on your derriere all the time. But all those things are injurious to the back. And you have to make some difficult decisions. Put yourself in, I'm going to use this term. Sometimes you have to put yourself in enough pain, and I'm talking about emotional pain, that enough is enough, that you're not going to take it anymore, that you're willing to do what you need to get done. It's amazing to me over all the years that I've been in practice, how difficult it is for people to change habits. And it has to be a repetitive process. We react, we blow up, we can't control it, it seems. We don't get up in the morning until it's, we have to get up, instead of getting up and, doing a little meditation, a little prayer, stretching a little bit, going for a walk, and then eating something that is really supportive instead of grabbing, a donut and a cup of coffee. I see patients every day of the week that unfortunately refuse to make little changes. There's a book that I really appreciate by an author called Robin Sharma, and it's called The 5 a.m. Club. And it could be 6 a.m. if you want to move it up a little bit. But the 5 a.m. Club is really about the people who are the highest producers, the ones that are in the best conditions, the people who have the best attitudes, the ones that get more done in 2 hours of the day than most people get in a day and a half. If you want to enjoy a good read, I would do that. There's another one that I really like that came off of him too. Is called the Saint, the Surfer, and the CEO. He's an excellent writer, but it gives us life lessons. There's so much that's out there. Get out of your pain pattern, meaning get out of your own way and make little changes that can totally restore your lifestyle. It's not okay to hurt. It's not okay to be in a place where you have to suffer all the time. I don't know about you, but I've spent my entire professional career in my life trying to tweak and tweak and tweak and tweak and tweak. And the old cliche, what do you expect for your age? I don't know about the rest of you, but I know what I expect from my time in this world is to try to make it as better as I can so I can optimize my day. But if you got low back pain, you're not getting up. You don't want to go do anything. You hurt. You're out of balance. You stand up and you have to stand there for 2-3 minutes before your back loosens up, before you can even begin to walk. And then some of you are already on canes, and some of you have to grab onto railings and chairs to be able to move you forward. Wouldn't it be nice to change that? And we're talking about moderation. I'm not talking about making you an Olympian, but we also have to understand where all this is coming from, and we have to fix the cause. What we're talking about today is how trauma, old trauma, new trauma, in-between trauma that happened to the head is going to reflect itself into that low back, causing muscle weakness and inhibition, and then causing those bones, those vertebrae, to jam and cause the nerves perhaps to stretch or to compress. And now you got pain and you have a lot of dysfunction. Join us this coming Wednesday evening, the 16th. Be there with us. I promise you it's going to be a show and tell demonstration. We'll have some fun. Dr. Browning's brilliant. We'll get you out of your back pain. Remember, I'm here all the time for one reason, You deserve this information because you need to know a different perspective, but simply this. I love you all. Have a great Sunday. Bye.